All right, so it looks like we have a fairly broad cross section here, so I think we'll get started and let some other people join in. So good morning. Thanks for everyone participating in what will hopefully be the last Town of Sydney Emergency Committee meeting of 2020. This time I'd like to call the meeting to order, and to begin I'd like to recognize that this meeting is being held on the traditional territory of the Wasanich First Nations. I'd like to move adoption of today's agenda and look for someone to second that.
Move adoption.
Oh, marvelous. Thank you. All in favor? Kumbaya. Excellent.
No seconder, but that's okay.
That's okay. We won't worry about formality near the end.
Formality's okay.
And then we'll move adoption of the minutes from our November 18th Emergency Planning Committee meeting. And I see a spattering of hands going up here and there. Move adoption, marvelous. Any errors or omissions from either the agenda or the minutes, previous minutes circulated? Based on the silence, I would say that things are going just splendidly. So we'll delve into old business, and the first item is our senior care home update. And I'll just add that Deputy Harmon is on holidays now until I believe the 4th. Oh, there's Jesse. But he remains in weekly contact with all of our extended care facilities. We have been doing some regular business at those facilities in respect to medical aid calls, but fortunately no COVID concerns to this point. So we remain cautiously optimistic that things are going well there, and all the directors of care seem to don't have any wants or requirements of us at this time. So that's positive. I don't know if anyone has any other comments on that particular topic. Marvelous. Our other old business, our mass notification service provider. So that's the app that comes through the phone and is represented by the various signs that you see at the entrance to Sydney. We've changed, or going to be transitioning to a different service provider. Our previous service provider was purchased by a large US firm, and basically the cost and the service provided basically just wasn't consistent with what we had originally kind of signed up for. So a lot of credit to Donna and to Mike. They did a lot of work working towards finding another service provider that met all of our requirements. And of course, there's a lot of privacy concerns, data and servers being housed in Canada, making sure that we don't have to really go and put the burden on all of our subscribers, which are well over 4,000, to re-enter information or go kind of through a large process. So that was a lot of work to go to that, and we'll be transitioning to that early in the new year. And Donna, you can probably expand on this, but it's probably February, early March. Would that be correct? We'd be transitioning to the Connect Rocket platform.
That's correct. We're actually transitioning in the background already. We've got it kind of set up, but as far as actually moving residents over, it won't be until the new year. Just coordinating amongst 3 municipalities right over Christmas, it seemed very tight and rushed. So we made the move to extend it, which I think was wise.
And in addition to that, I think we'll realize actually it's a PMO initiative. So, but it'll result in a significant cost savings with no decrease in the provision of service. So it's a lot of work, but there's the end result's quite positive. So that'll probably have a more fulsome report on that probably in our February meeting or something like that, once we get things very close to going live on that new platform. The next one or item would be the emergency evacuation grant application that was brought before council on Monday. The go ahead to make the application was unanimous by council. And Donna, do you have any rough idea? Did they give you any idea roughly when that decision would be made, or we'd have an idea of when that might we'd be notified?
We're hoping to hear sometime in February was what we were told. Okay. Again, hopefully the February meeting will have an update for everyone.
Excellent. Any other old business or kind of existing concerns people have pertinent to this committee before we transition to new business? Obviously, hearing none, we'll go straight into our EOC level 1. And just as a reminder, you know, the rationale for standing up our EOC at a level 1 was largely for monitoring. Was one of the key plans, is to really keep abreast of what's going on. It's not an exaggeration, and you know, Donna could, you know, kind of back me on this, that if we wanted to participate in every regional and provincial committee or emergency program Zoom meeting or conference call that's been stood up in response to COVID, that'd be more than an 8-hour day in itself. It's crazy. So obviously we don't do that. We try to make sure we only spend an hour to an hour and a half and try to triage which are the most, you know, applicable and worthwhile conference calls, or, you know, doctors, to make sure that we're asking the pertinent questions or getting the information. But there's no shortage of committees, whether it's the CRD, the Regional Emergency Planning Committee, the local emergency government, you know, all of the subcommittees for out of the CRD, and then of course the whole raft of EMBC and provincial health, various conference calls and Zoom meetings that are all applicable to exactly what we're responsible for. So we're doing our best. We can't attend everyone, but we're still trying to glean the best information for what we can. And I know Randy is obviously through the CAO group and the like, is, you know, to a lesser extent is you know, attending or getting that information as well. The other rationale or kind of prime driver for having the EOC open on this very limited basis is just to have another kind of dust off our EOC business continuity plans and really see where we are there in respect to, if things change dramatically or continue to deteriorate, which they are, what are we going to do? And, you know, the request has been made through Randy and the EOC to the directors and the managers, is to, you know, provide kind of something quick on paper that articulates, you know, what are the plans in the event that there is an outbreak that either affects your functional group or department, or provincial restrictions mandate or change, you know, our operational, our delivery model. And these are more focused on essential services. And by essential services, you know, every department has some essential services, obviously IT, otherwise we couldn't meet. People get very unhappy if Andrew's group cannot process payroll. Obviously, you know, my end of things, people get unhappy if they have to wait to see someone come for a cardiac arrest or a fire. And then of course there's roads and, you know, provision of water, sanitation. All of those are kind of the essential services. You know, we don't have to cut the grass. We don't have to do any of those things, but there's other things we have to do. And those are the things we want to make sure that the plans are dusted off. And if some key staff were affected or had to isolate, that another manager or the emergency operations center could just grab, you know, a quick 1 or 2 page kind of algorithm that says, you know, call this person, call this person. If we get down to the bottom of the page, perhaps it's reliance on another municipality or kind of or subcontractor, and the numbers are there and we go. And that, so I don't know, I haven't seen that. I don't know if it's coming to you, Donna, but that's kind of an expectation we'll want before people go on holidays. So if things go bad, we have that. So Randy, you want to add anything?
Just to expand on that, just back to the EOC level 1 stuff. So actually I was on a call with the administrators this morning, and we're now having regular calls at every second week sort of interval. But so we had one this morning, and we're not alone. Every other pretty much municipality in the region, including the CRD, is at an EOC level 1. And that means different things maybe to different municipalities, but it's the lowest level EOC, so they're touching base. Other municipalities are touching base once a week or sometimes twice a week, etc. Principally meeting virtually, like us, that kind of thing. So we're not alone there. Yeah, and with respect to the sort of internal department-based response plans based on critical service provisions. Yeah, I think it is important that that we get that done on a department basis. I'm just trying to wrap administrations up actually today and get that off to yourself, Brett, and Allison, and Donna and Mike, so you guys can review that. But it can be a simple template. We don't need to sort of create a master's thesis here. It's just basically putting something down on paper, so we're not having to make it up on the fly. And in fact, again, we're not alone here. There was a bit of a discussion at the administrators meeting today about this. In fact, the CRD, Bob Latten, their CAO's meeting with their senior staff about this very thing today, just getting these kinds of internal critical operation plans together. So yeah, I just think it's important that we focus on this and try to get it done in a timely way, so we've got something should, in the event we need it.
Yeah, and to echo your comments, right, it's not meant to be a, an exhaustive volume of requirements. It could be like a 1-pager or 2-pager type of very, like I said, I built mine as an algorithm. This doesn't happen here. There's an arrow, you do this, you do this. It's very, very simple. But again, it's just something that we require before we kind of break for the holidays, so we have it as a worst case scenario. Any questions, concerns on that? Clarification required? Oh, this is too easy. This is now I think, Allison, did you want to speak to this? I can make a few comments, but it's more just the Emergency Operations Center and staff holidays. I know this is something that you requested be added to the agenda.
Yeah, I just wanted to touch base on what the expectations are over the holidays. I know we've met weekly for the past couple of weeks just virtually, and I wanted to know, would we still be doing that, or are we going to kind of stand down for the Christmas closure week, and what the expectations are around that? Maybe just communicate by email.
Yeah, Donna and I kind of had a brief conversation, and we have been the last three or four days about this, and I'll be working over the holidays in and out. So I'll be obviously on a reduced basis participating, and there'll be a reduced number of calls and the like, but I'll be available. And if there's any concerns or anything like that, either my phone or my email will be answered kind of daily, and we'll just kind of go through myself. And if there is a requirement to kind of increase our staffing or our response in any way, shape, or form, I mean, we're all provided cell phones and email, and we shouldn't be going anywhere. So eventually we could glance at our phone, and it's not like we're going to Hawaii, or you shouldn't. I wish we could. So we're going to be around. You can kind of use myself as the conduit, and we'll push it out if required. But hopefully that's not the case. But I think that's the best way to kind of keep this kind of going on a reduced level, at least until we reconvene in early January. You have some consensus on that? Does that make sense?
Yep, that sounds good. Thank you.
Excellent. Although it's going quite quickly here, I'll just open it up. Is there any new business?
And perhaps we can perhaps cover it in the round table, Brett. But Wayne, I know Jen was in touch with you with respect to sort of what's happening around bylaw enforcement calls over the holiday period. Given we've got one bylaw enforcement officer, he's going to be away for a bit during the Christmas closure, so right now his role is if there is a call to attend say an incident around gatherings, or someone not following mask wearing protocol in a public place, etc. He's there to provide, education and that sort of thing. He can't issue tickets. His enforcement capacity is limited by the health order. But anyways, so RCMP is aware of sort of what their role and function is, I guess, as well, and that those types of calls will, I guess, be directly forwarded to the RCMP. I don't know if you've looked at that, Wayne, or.
Yeah, well, we have, yes, I did get contacted by Jen. And we have had pretty explicit communication from our senior management about the COVID Measures Act and what's enforceable. And so I think everybody has access to the information they need, given whatever the scenario or type of call they might get called to. We have probably seen a little bit of an increase, but not significant at this point. Not sure what to expect over the Christmas holidays in terms of people respecting and following the provincial health orders that have been put in place. So I'm not concerned about what Jen has shared. We'll pick up what's needed and do what's required to respond to those things as part of our enforcement mandate.
Great, thanks, Wayne.
Yeah.
Any other new business, or we could just kind of seamlessly transition into a roundtable? Any other concerns or comments anyone would like to make? This is what there's Allison.
That's
Yes.
something. The other day I forwarded around that BC Center for Disease Control dashboard on the results from the provincial COVID survey that was done in the summer. I received it from somebody at the CRD and found it pretty interesting. You can dig down to a very fine grained level and see Sydney specific data results for a lot of the criteria, or a lot of the questions that were asked. And I thought that was interesting in terms of seeing how people locally are feeling they're doing with things, how they responded, that they're following the protocols and feeling about the changes and what impacts they've had. So I thought that was interesting. So I was impressed that you could get down to that level of detail. I thought it would be more general, like South Vancouver Island. And some of it seemed to be, but a lot of it you could get right down to the municipalities. So, yeah, hope that's helpful for people.
Yes, that's interesting. I honestly have not kind of had time to delve into that, but that is interesting. I think we're all justifiably feeling a bit of COVID management fatigue. But we're on the home stretch, but we definitely can't let our foot off the gas here. From a vaccine perspective, it's my understanding, and Wayne, I don't know if you know, but I believe our kind of cohort of police, fire, and ambulance are scheduled for late March, early April. Have you had any confirmation or notification of that?
No, I haven't actually.
Okay, that's my understanding is that we'll be in that group. Whether that's the Pfizer vaccine or the Moderna vaccine, or a lot of things can change between now and then.
Would that be a very similar rollout to the flu vaccination process, Brett?
I really don't know, because it's my understanding that the way that they're triaging this, it's province, each provincial health officer is kind of taking a slightly different look at it. But I believe in BC, it's critical care, ICU type practitioners that are getting the absolute first doses, because they're so specialized. There's so few of them that we have very few ICU beds, but we have even that many respiratory therapists and ICU nurse staff. So if they go down, it's truly dire. So they're kind of working backwards from that. And then obviously the more at-risk populations in nursing homes and those over 80 with comorbidities and those type of things. And then kind of secondary healthcare providers outside of the, COVID ward specific care environment, police, fire, ambulance. They're thinking late March, early April. And
I was sort of wondering what it would look like when it gets around to general community distribution.
That'll be summer, fall, best case as it stands now. So, if you want to go mass shopping, unfortunately, you're not going to get to hang them up anytime soon. That kind of practice is with us for a while, unless things dramatically improve or, vaccines become much more readily available and you don't need a second dose. The thing about the Pfizer vaccine is you need, after the second dose, you still need, I think, upwards of 4 to 6 weeks for, greater than 90% efficacy against it. So it's a long ways away. It's very positive, but we're getting closer, but we're not, we've still got a ways to go. So there's some work to be done. Yeah, it's kind of
we're at the 32K mark in a marathon. So the last 10K is when the marathon starts. So
exactly. Yeah. Well, I'd let you say that, but yeah, we're getting close. It is positive, but the numbers are, pretty scary in respect to looking at the curve and the number of cases, and that's obviously to a lesser extent than in Fraser Health, but I think the last I heard there was upwards of 90 confirmed cases on the island. So that's concerning.
There's still no cases at all in Sydney to date?
Oh, well, and again, they don't, the Ministry of Health, I know there's been cases in Sydney, but the Ministry of Health does not publicize cases unless it's linked to an institutional outbreak. So if you're positive and you're isolating at home, you're staying at home and then you're transported by ambulance to a hospital, that's nobody's business other than the contact tracers and the people that you've been in contact with. It's only an institutional outbreak that they'll make public. So
no long-term care outbreaks though.
No long-term care outbreaks. And I believe even if there was an outbreak in a large condo complex or something like that, they may, if it was large enough, they would likely publicize it. But and Dawn, I know you had something to say that it's not, there's privacy issues. I mean, you're allowed to get sick and go to the hospital. It's nobody's business. So we have no idea, but I can tell you unequivocally, there's, Sydney's definitely, there's been COVID cases. So I don't think that's a surprise to anybody.
Yeah.
Brett, Laurel had a question.
Hi, when the first responders are getting vaccinated, do we know whether or not that's going to involve support staff, or will support staff be in the general population?
That's an excellent question that I don't have an answer for. And I don't honestly think that they even have an answer for that yet. Obviously, we'll do our best to, those are the type of the various conference calls and Zoom meetings that we will definitely be attending. And when we kind of find out when those are being more closely, when we get closer to that time, we'll definitely make sure yourself and Wayne are part and parcel of that, but we're not 100% sure yet. It was just kind of our understanding was late March, early April for police, fire, and ambulance. And I don't think they articulated whether that was a frontline worker or support staff. I don't think that's even been, thought of yet, to be honest.
Okay, thank you.
Thanks, Brett.
Donna?
Just when Corey was asking about cases in Sydney on a local level, they did confirm on a call this morning that they're still having cases come out of the San Pen outbreak and it's still ongoing. So it's in our community, maybe not specifically in Sydney, but it's close to home for sure.
Yeah, and obviously I can't get into things, but I mean, we do emergency medical calls and, we wear gowns for a reason. I'll leave it at that. So it's out there, and we need to be cognizant of that. We're not there's no Fortress Sydney where it doesn't affect it. It's definitely everywhere. So that I can state. Any other comment? Oh, Randy.
Just on the I guess meeting schedule. So typically the EPC meets quarterly. We've gone to monthly meetings. Does the group want to continue with that monthly meeting? Is it valuable to the group to continue for the next little while on a monthly Zoom call?
I would jump in.
Put it to you and the group, I guess.
I would think the answer would be yes. I mean, today is going to be a relatively short meeting by the looks of it, but particularly, trying to put a positive spin on things is as we get, closer to rolling out vaccine scheduling and all, hopefully we can start talking about, one day the reduction of, when is it appropriate for us to kind of transition back to what was normal. I think we want to meet monthly to articulate those and discuss those and do those type of things. So, my notes here basically stay in, until, we don't have really a provincial health emergency that's changing the way that we do business. It's probably best that we meet monthly, just even for a short period of time to, exchange some information. It doesn't have to be a long meeting, but until that time, I would recommend we continue to meet monthly.
Yeah, I'd agree as well. Okay.
Is that it? Is that all? Any other questions, concerns? 2020 has been a very long year.
But I would just add that we sort of just this week moved to tightening things up within the detachment. Part and parcel because of what, like Donna was mentioning, the sand pens getting close to home. We also became aware of an Up Island detachment that have 2 officers testing positive for COVID. Obviously, that creates some real internal issues for a workplace like a police detachment. So just a few things that we're doing here. I mean, our briefings were going to reduce to a very small bubble where we were having, bigger meetings because we have so much information to relay and stuff like that. But I think we got to a point where our members were questioning, was that sort of that risk assessment thing. So just sharing that.
No, that's very good info. And I would just add that, I've read some interesting case studies and also working for the provincial ambulance service. It's the exposure and the case positive, people are, you think that you go do a COVID call. I think there's been something like 15,000 contacts or something like that at BC ambulance service, or I don't even know how many, but it's a huge number. And there's only been 2 or 3 paramedics, or I think upwards of 5 paramedics that have been positive, have a COVID positive result. And only one of them is presumed to be from a workplace encounter. The other ones are resulting from, what they call a social exposure. I also read, there's a similar case study out of the States where they had done thousands of COVID, transports, ambulance transports. But the only positive cases they've had from their firefighters and paramedics have been as a result of, somebody just saying, I've worked, 24 hours straight and I'm going for a beer with my buddies. And they let their guard down, and it was directly, traced to that. So it goes to show that if you're taking the precautions and gowning and donning and doffing and using, personal hygiene and all the proper things that we're taught to do as first responders, the risk is exceedingly low, and probably you're even safer because you're going to be exposed to it. So you're hyper vigilant and taking all the precautions. It's the social environment where you might be lax and let you have your guard down is where all these case positives are coming from. It's exceptionally rare that you get it in an environment where we're actually responding and we're following our protocols and our guidelines. So it's kind of more just to highlight if we're going to get it, it's more likely we're going to, because we're lax at home or or, you know, in a social environment versus kind of in a professional environment.
Yeah, thank you for that.
Well, that's all I have. Barring that, it looks like our next meeting is January 20th. Is that correct on that? Andrew?
Just, a quick thank you to anyone who took part in EOC response, and especially to those who have continued to work in recovery. Chief, Allison, Randy, great work.
Well, we're all part of a team here. It's all good, and I'll look forward to hopefully in the summertime we can get back to a quarterly meeting schedule and get back to some of our more kind of pre-identified strategic things like drinking water and the more mundane things versus COVID. But we'll get back to those. But until such a time, I just like to thank everybody and wish them a happy new year, and we'll reconvene in January. So thanks very much.
Thanks, Brad. Thanks, everyone.
Take care.
New Year.